Hi, my name's Craig Deao. I've been a senior leader with Suter Group for the past decade, where we're committed to helping healthcare organizations create highly engaged leaders, physicians, employees, and patients and family members most especially. In this short video, I want to talk about why that even matters in the first place. Let's start with engaged employees. One of the definitions of an engaged employee is that they do what evidence suggests they ought to do, even when nobody's watching. And so it might not surprise you that engaged employees are more likely to wash their hands. One of the measurement vendors that correlates employee engagement to the hand hygiene compliance rates on units has found a strong correlation between the two. And you think about it, doesn't that just make sense? If engagement's about whether I do the things evidence suggests I ought to do when no one's watching, isn't hand hygiene then maybe one of the ultimate markers of how engagement of the person can actually influence quality and care outcomes? Because you know that the current success rates with hand hygiene compliance are not where we want them to be. While obviously we'd like it to be at 100% due to the impact it can have on nosocomial infections and costs and deaths, we know unfortunately that it's more like 40 or 50 or 60%. So I encourage you, look at your own organization. If you work within a healthcare facility, if you have engagement data broken out by unit, look at that and see if there's any correlate at your place to hand hygiene compliance. I bet you're going to find some interesting results. Engaged employees also engage in the safe practices that we need them to. Dr. Grant Savage, one of our colleagues at the University of Alabama at Birmingham's Business School, did a great study finding that the more engaged employees in a workforce are less likely to work around safety protocols. I remember when I started my career more than a decade ago, he was working extensively in quality and safety. I remember when barcode medication administration came out, and I remember thinking, wow, it's going to absolutely address some of those 5 rights of medication administration, right? It's certainly not giving it to the wrong patient anymore. I mean, after all, if you've got to use that scanner to scan the labeled unit of use pharmaceutical and make sure it matches scanning the patient ID band, then how could you ever give it to the wrong patient? Well, it turns out that busy professionals who don't see the value in the new process and don't engage in it find workarounds to everything. And I remember hearing with horror the story of the organization where a nurse at the nurse's desk, in the interest of time and thinking she was doing an okay thing, printed out some of those patient labels at the desk, and instead of actually checking against the ID on the patient's wrist, scanned the labels and scanned the medications right at the desk and then put them on the cart and went out delivered. And inevitably, you know, we heard about that because of the unfortunate events. That's not what highly engaged employees do. What do engaged physicians do? Engaged physicians do exactly what is being asked of medicine right now in this time of transformation, delivering higher quality care at a lower cost. And there's lots of evidence behind this. Highly engaged physicians improve health outcomes. We know that simply deciding to have that conversation with a patient increases the likelihood that they'll stop smoking by 30%. In a large population study of patients with diabetes, we knew that one of the strongest correlations with whether those patients refilled their medications or not was the perceived empathy of their prescribing provider. Empathy, really interesting variable. So they help improve health outcomes and help patients become competent in their own care. We also steward resources better as highly engaged physicians. In one organization study found 51% more inpatient referrals, 26% more productivity, and $500,000 differential in annual patient revenue. That's the gap between the most and the least engaged physicians on the CM team. And how about engaged patients? Again, on quality and cost. You can't fix either of these in our industry without them. You cannot fix the healthcare cost crisis without them. We all have a role to play in effectively stewarding the nation's resources when it comes to healthcare. But the most profound impact that we can have is those of us managing our own health, because it turns out a few chronic issues like diabetes and cardiovascular disease account for the majority of deaths and 3/4 of what we spend as a nation on medical care costs. And we know that those are largely preventable or modifiable. And the big lever is also very well known, right? It's about increasing physical activity, it's about controlling our weight, and it's about not smoking. And I'm asking healthcare provider organizations to consider how they're helping support those 3 big levers of the most expensive part of our healthcare system, of physical activity, weight, and smoking. And You may not be the lead in your community on that. How are you engaging with others in the community to become a true source of health and wellness to influence those costs? And we also know that it requires an individual commitment. It's not a paternalistic relationship that will solve this. Accountable care requires me, the patient and family member, to be accountable. To me, this comes most profound when you think about how our typical encounters between caregivers and patients occur now. The average visit lasts 20 minutes. The average patient has 3 of those 20-minute visits a year. That's 1 hour. 1 hour of FaceTime between the patient and the care provider. So what about the other 8,674 hours? A couple things out of this. You could think, gosh, we have to really extend those 20 minutes and those 3 visits to, an hour a week, 2 hours a week. I think it's highly unlikely any health reform will come about that it has the financial resources for a physician to spend that much time with all their patients. I would actually argue that some of your patients need 2 hours a week. That's a very small percentage, and they probably also need a lot of care coaches in the meantime and supported by technology so that they have a more enduring relationship in those interstitial moments. And then there's others of us that are fortunate to be healthy and not having any pre-existing conditions that probably need to see the physician maybe even less than that. There's some evidence that would suggest that those annual visits for certain populations may not be as necessary. A lot of the tests certainly not contributing to health, but maybe necessarily to cost as well. So it's about differentiating in the patient populations, and one of the best ways to do that is actually to start measuring engagement. There's a new emerging measure that Dr. Hibbard from the University of Oregon has researched extensively called Patient Activation Measure, or PAM scores. And coming out of that, we have even more evidence of this impact that patient engagement has on both cost and on quality. On cost, one of the most incredible studies out of this, published in Health Affairs, showed that the most engaged patients this year cost the healthcare system less money next year. My engagement this year predicts next year's cost. That's a phenomenally interesting data set to me. And why is that the case? Because the more engaged I am, the better health outcomes I have. The more likely I am to effectively control my cholesterol, the less likely I am to smoke or be obese, the more likely I am to effectively use preventative tests and treatments, and effectively use resources like the emergency department. So there's phenomenal evidence behind the impact that having engaged patients, physicians, and employees have, and I look forward to seeing the progress we'll make as an industry on this in the years to come.